Hello, Professor. Our today's topic for data story is mental health issues globally. We are Group 7. My name is Digvijay Singh, and my fellow teammates are Aisha, Sharon, and Sandeep. Next slide, please. So as a brief introduction on mental health issues, we all know mental health is a crucial global issue that affects individuals of all ages, backgrounds, and socioeconomic status. According to WHO, approximately 25% of the world's population will experience mental health issues at some point in their life, which can take various forms, such as anxiety disorder, depression, bipolar disorder, schizophrenia, and many more. Mental health issue can severely impact an individual's daily functioning, leading to difficulties in personal relationship, work, and daily activities. Despite the growing awareness of this issue, stigma and discrimination surrounding mental health still persist in many parts of the world, making it challenging for individuals to seek help and receive adequate support. Therefore, it's vital to recognize and address the importance of mental health globally and to promote the availability of resources and support for those struggling with mental health issues. By prioritizing mental health, we can work towards creating a more supportive and inclusive society for everyone. Next slide, please. As in this slide, we can see the distribution of mental health disorders. Mental health disorders are a significant global challenge affecting millions of people worldwide. Our data indicates that in 2017, nearly 1 billion individuals experienced a mental or substance use disorder. Anxiety, anxiety disorder were the most common, affecting approximately 4% of the global population. However, depression and alcohol abuse were also prevalent, affecting 3.47 and 1.55% of the population respectively. The widespread of occurrence of these disorders emphasize the need to prioritize mental health support and resource globally. Depression, for instance, is a leading cause of disability globally and can severely impact on individuals' daily life. Similarly, alcohol abuse can lead to serious health complications, including liver disease and heart problems, and is often associated with mental health disorders. To describe the prevalence of mental health disorders and improve the quality of life of affected individuals, addressing the underlying issues is necessary. This can be achieved through initiatives like increased funding or for mental health services and education on the importance of seeking help for mental health disorders. As in this data set, we have gathered information on the most common mental health disorders, which are uh, alcohol abuse, anxiety, and depression, and there are many more. Thank you. Next slide. Yeah, in this slide, we can see depression in different age groups. Depression is a complex mental health disorder, and according to the available data, individuals aged 50 to 69 or 70 plus have the highest rate of depression, with prevalence rate of 5.66% and 6.13% respectively. And also the prevalence of depression tends to be lowest among the children and adolescents with an average of 1.38% for 10 to 14-year-old. Interestingly, the prevalence of depression tends to be lower in individuals aged 15 to 29, with the rate ranging from 3.07% and 15 to 19-year-olds to 3.91% in 15 to 29 years old. Possible reasons for this includes greater resilience in younger individuals and the fact that many mental health disorders tend to manifest in later adulthood. As we can go on the next slide, I would like to call Aisha for that. Thank you.
Good day, Professor. I'm Aisha, and I'm going to be talking about depression by countries and gender. Improving on what Digvijay said about depression, Depression is a common mental health disorder that can have a profound impact on an individual's quality of life. It is characterized by persistent feelings of sadness and loss of interest in activities that were once enjoyed. From the chart, we are looking at the chart depicts the prevalence of depression by gender in different countries. From the first glance, we can see that the females tend to experience depression more frequently than males. This could be due to a variety of factors such as hormonal differences and the likes. Also, the chart shows us that there is a considerable variation in the prevalence of depression among different countries. Suriname, for instance, has the highest percentage of people, male and female alike, suffering from depression, while Peru has the lowest number of females and males also battling with depression. These differences could be due to a variety of factors such as access to mental health resources, cultural attitude towards mental health, and socio-economic factors. It is important that to note that depression is a major risk factor for attempted suicide and suicide also. Individuals with depression may experience feelings of sadness and despair, which leads to thoughts of self-harm or suicide. So suicide is the second leading cause of death among individuals aged 15 to 29 globally, which highlights the importance of recognizing and addressing depression as a serious mental issue. The next slide is about attempted suicide and suicide rates by countries. Mental health conditions can cause overwhelming emotional distress, which can lead to thoughts of self-harm and suicide. The column charts we're looking at shows the prevalence of attempted suicide by country and gender. Samoa has a high rate of attempted suicide at the rate of 110.9 and 95.4 per 100,000 people for males and females respectively, which may be related to a lack of access to mental health resources, high rates of poverty and unemployment, and the likes. On the other hand, Indonesia has a lower rate of attempted suicide for both males and females, which may be related to a strong support system and cultural values that prioritize community and family. The second chart, which is the bar chart below, it shows the suicide rates of different countries. Kiribati has the highest suicide rate in the world, with a reported rate of 730.3 suicides per 100,000 people. And this is a significant public health issue that requires attention and intervention in the society. On the other hand, Jamaica has one of the lowest suicide rates in the world, with a reported rate of 43.6 suicide per 100,000 people. However, it is important to recognize that even one suicide is a tragedy, and suicide prevention efforts should be prioritized in all communities, regardless of the reported rates. I'm going to hand over to Sharon to talk about bipolar disorder.
Thank you, Aisha. So my name is Sharon Bandele, and I'll be walking us through bipolar disorder globally and the use of marijuana and anxiety disorder globally as well. So bipolar disorder is a mental health condition characterized by extreme mood swings, including periods of mania and depression. And it can be managed with medication, therapy, and lifestyle changes. So we've used a bubble chart here to show the distribution of the prevalence of bipolar disorder by countries. And as can be seen from the chart, Dominican Republic, Trinidad and Tobago, Peru, Uruguay are some of the countries, as well as Jamaica, some of the countries with the highest numbers, highest rate of bipolar disorders. And countries like Kiribati, Laos, have the least number or the least rate of bipolar disorder by countries. Overall, these statistics indicate the mental health condition can vary widely in prevalence across different countries, and understanding the factors that contribute to these differences can help us to manage the uh, rates at which the condition grows rapidly. Next slide, please. So in this slide here, we've been able to visualize the prevalence of the use of marijuana distributed among countries, as well as the prevalence of anxiety disorder using a map chart distributed amongst countries as well. So marijuana usage can have a range of effects on mental health, depending on factors such as frequency of use, potency, and individual susceptibility. While some may use marijuana to alleviate symptoms of anxiety or depression, it can also worsen these conditions or trigger psychotic episodes in some individuals. Anxiety disorder, on the other hand, are a group of mental health conditions that are characterized by excessive worry, fear, and avoidance behavior. Treatment options may include therapy, medication, lifestyle changes such as stress management techniques and exercises. And from the tree map, we can see that Samoa and Jamaica, they are leading, or they have the highest number of marijuana usage, the rate of marijuana usage across these countries. And seeing Samoa amongst the list of countries with the highest number is not too surprising because uh, they also have highest number of suicide rates, I guess, from the chart Aisha explained earlier on. And also for the anxiety disorder, we can see some countries like Peru, Sonim, Mongolia, and Namibia, and the rest are part of the distribution of the prevalence of anxiety disorder amongst countries. So the rest of the presentation is going to be taken by Sandeep, and I'll be handing over to him. Thank you.
Thank you. This slide all about the countries with highest number of depression disorders. So the data show that some countries have a higher prevalence of depression than others, with the highest rates found in countries such as India, China, and United States. An estimated 7.5% of Canadian Indians experience depression, with women more likely than males to experience. Moreover, depression is estimated to be a 6.5% of prevalence in China, with rural areas being more impacted than urban areas. So approximately 7.6% of Americans suffer depression each year, with percentage varying depending on characteristics like age, gender, their social economic background. So it is important to remember that a number of variables, including access to mental health services, cultural value of mental health, and social and economic inequality, may have an impact on a country's prevalence of depression. Next slide, please. This slide all about the depression based on education level. The entire chart which breaks down the prevalence of depression by education level and work position among the OECD countries offers helpful information. The information only includes person aged 25 to 64 and is based on the self-reported prevalence of depression as investigated by the surveys. So according to the graph, those who have completed post-secondary education tend to have the lowest rate of depression throughout the majority of countries, whereas those who did not complete upper secondary education had the highest rate of depression. So the graph also demonstrates that compared the people who are actively looking for work or the general population, which include unemployment people, but the people who are employed tend to have lower rates of depression. So this finding highlights the importance of employment as a protective factor for mental health. Next slide, please. Conclusion. Based on the data analysis, it is clear that millions of people worldwide suffer from mental health disorder on an annual basis. So the data also highlights the mental health disorder affect individuals across all ages groups, with some groups being particularly vulnerable, such as adolescents and other adults. Moreover, depression and suicide rates appear to be a positively correlated, indicating a need for increased attention to suicide prevalence strategy. It is evident from the analysis that there is a need for more research to better understand the cases and mechanism of mental health disorder, as well as to develop more effective prevalence and treatment strategy. In the last, mental health issues are a serious public health issue that needs constant attention and action from decision makers, mental professionals, and people all around the world. Millions of people's life can be improved and a better. More society can be fostered if we give mental health the attention it deserves and invest in its prevalent treatment and support. Thank you.